Hi, I'm Dr. Ngozi Onuoha. I'm the founder of Help for Naija. So, what does Help for Naija do? It's a health education platform, and we provide health education content for multicultural audiences and the diaspora community to improve health outcomes. So, I'm going to talk about the month of May and health awareness for the month of May. So this month has Mental Health Awareness Month, as well as Hepatitis Awareness Month. So lately, I've been watching the Queen Charlotte series on Netflix. So who's watched it? I'm sure most of us have watched it. So I really looked forward to watching this series, but I was somewhat disappointed because it really focused on the mental illness of King George III. So mental health is very important. This is Mental Health Awareness Month. And mental health includes psychological, emotional, and social well-being. Mental health impacts how we think, we feel, we act, make choices, and relate to others. So I was really surprised to learn about the madness of King George III. And his behavior was later identified as bipolar disorder with hypomania. I mean, what really upset me with this series was that no one had disclosed this mental illness to Queen Charlotte before marriage. And I was also disappointed that there was no treatment that was effective for him. And in fact, he was subjected to barbarism, which, needless to say, made his mental condition worse. So as the movie goes on, we can see that the lack of awareness, the lack of disclosure of the king's mental illness to Queen Charlotte made her increasingly despondent and lonely. So for me, I know the series has gotten really great reviews. I found it to be a little bit sad. So today in America, loneliness, isolation, and lack of connection have been declared a public health crisis. Loneliness and isolation increase the risk for individuals to develop mental health challenges. So this is something that the American public health system is trying to combat, the issue of loneliness and isolation. Mental illness makes everyday activities difficult for the affected individual and people around them, as well as their relationships. And more so if communication is not honest. And we know there's a lot of stigma around mental illness. Mental illness pushes people to withdraw, especially if they are not feel they're not well understood. And as they withdraw, as their mental health declines, as well as their physical health. Their physical health declines. So currently, there are a lot of medications for mental illness, effective medications, and they allow people to live a long and productive life. And also, I want to mention that America has launched its 988 mental health support line. And the 988 number connects individuals with crisis counselors for emotional support. And the 988 number can be accessed by texting to 988 or dialing 988. You can access that number. So if a person has mental health concerns, it is important to seek professional help from a mental health counselor, co-therapist, or a psychiatrist, and not try to solve their own mental problems themselves. Okay, let's talk about hepatitis. May is Hepatitis Awareness Month. And the two big hepatitis that cause problems are hepatitis B and C. And often they are silent and people don't present with them until they've had blood work and the blood test shows that they have hepatitis B or C. So there is vaccine against hepatitis B, but there is no vaccine for hepatitis C. Hepatitis C is a silent problem because, like I said, it may not have any symptoms. And as millions of the hepatitis C virus replicate or reproduce, they cause liver damage with possible progression to liver cancer. But we know there is a cure for hepatitis C, and the cure consists of medications, tablets that can be taken for either 8 or 12 weeks and can cure hepatitis C completely. But the medicine is expensive. So there are good treatments for hepatitis B and hepatitis C, and a blood test can identify hepatitis B and C. So that's all I want to say for now. I thank you for listening, and bye for now.